I'm Linda Hirsch, and this is EdCast, a program created and produced by educators for everyone interested in education. In 2021, the CDC reported that approximately 1 in 44 children in the US is diagnosed with an autism spectrum disorder, and that boys are 4 times more likely to be diagnosed with autism than girls. The challenges faced by these children and their caregivers extend into our classrooms as well. Today, EdCast speaks with an autism expert who is also the parent of a child with ASD. We'll discuss the many aspects of this disorder and the kinds of classroom environments that best support students with ASD. Coming up now on EdCast.
We are all different, and that's wonderful. Some differences are easy to see: height, hairstyle, eye color, and so on. Other differences can't be seen: our favorite foods, fears, or special skills. Interestingly, the way we see the world is also different. For instance, what do you see in this drawing? Most people see a duck, but some of you might have seen a rabbit. Whichever you saw, you are correct. This is just a trick drawing to show you that all brains work differently. The brain is your body's computer. It works differently for all of us and controls how you learn. That's why we are all good at different things. How you feel, which is why we all feel different emotions. And how you communicate. Sometimes the brain is connected in such a way it affects the senses and how we perceive and read situations and interactions. This is known as autism. Many people have autism, so it's likely you already know someone who is autistic. And for this reason, it's useful to know a little bit about autism.
My guest today is Autism Education Specialist Barbara Boroson. She has worked in autism education for more than 25 years in clinical, administrative, and advisory capacities. Barbara is the author of Autism Spectrum Disorder in the Inclusive Classroom: How to Reach and Teach Students with ASD, Decoding Autism and Leading the Way to Successful Inclusion, and the upcoming The General Education Teacher's Guide to Autism: Essential Answers to Key Questions, as well as numerous articles. She is a frequent speaker at educator conferences and a professional development provider at schools and districts nationwide. Barbara lives just outside of New York City with her husband, 2 fierce young adult children, and 1 timid rescue dog. Welcome to EdCast, Barbara, and thank you so much for joining us today.
Thanks so much, Linda. Thanks for having me.
This is a really important topic, dealing with autism spectrum disorder, and I know you have a tremendous amount of experience on this, both professional and personal. I want to start with the very basic. When we discuss autism, what does that terminology mean? People confuse things like Asperger's and autism. What are some of those distinctions that we should be aware of?
Honestly, it's changing all the time, but the most current answer I can give you, first let me address Asperger's, since you mentioned that. Asperger's is no longer an official diagnosis or an official subtype of an autism diagnosis. So even though for many years, many people were diagnosed with the Asperger's subtype of autism, they can still continue to use that term if they like, but it's not considered an official diagnosis anymore, and it's not being given out anymore. Instead, anyone who is considered to have autism and meets the diagnostic criteria for autism is diagnosed with autism spectrum disorder, which is a sort of a broad umbrella term. And then the specific nature of their strengths and challenges is delineated with a level system, level 1, 2, or 3, which reflects how much support they need to function adequately, or I shouldn't say adequately, but function at their best in society.
We mentioned at the outset some data on the prevalence of autism spectrum disorder, but I'd like your perspective. How prevalent is this?
At the moment, as of the latest studies, in the United States, 1 in 44 children is being diagnosed with autism spectrum disorder. And that is a huge increase. It's been that the diagnostic rate has been steadily increasing, up from 1 out of every 150 only 20 years ago. And now it's 1 in 44. This is one of the questions people ask me most often. Why are there so many people with autism these days? And I would say it's not, what I do say is it's not that there are so many people with autism or autistic people these days as opposed to in the past. What I think that the increased prevalence reflects is an increase in understanding and awareness among medical professionals, and also a broadening of the diagnosis, such that now it includes people who previously might have been diagnosed with something else or not diagnosed at all. So I really think that the diagnosis broadening primarily and increased understanding is what accounts for these higher numbers of people who are carrying the diagnosis, rather than that there are more people now who are on the spectrum.
That segues right into, how is this diagnosed? I think people really want to know this. How is it diagnosed? What do we look for?
It's not so much a matter of what we look for, but I will tell you that what constitutes an official diagnosis are challenges in social communication and social interaction, as well as limited, rigid, repetitive patterns of behavior and interest, and extremes of sensory reactivity. Those three components really need to be present for an autism diagnosis to be made. But now that your listeners are all sort of thinking, oh, that sounds just like my student or my neighbor or my cousin's daughter or what have you, the diagnosis can only be made by a qualified medical professional, psychiatrist, neuropsychologist, and so on. It can't be made by a neighbor or even a parent, or even a teacher. Teacher may see it, they may think it, they may even know it from their experience, but they're not qualified. They're not, it's not they're not qualified, but they're not allowed to make an official diagnosis.
So it's an official diagnosis made by experts.
Right.
At what age do signs typically appear?
It's very variable. For some who are sort of more profoundly affected by autism, it can be evident from very early ages. It can be evident from 1 year old or even sometimes sooner. But for others, those who were previously diagnosed with Asperger's, that would be those who are highly verbal, articulate, and whose challenges are maybe a little less external, a little more internal, a little less obvious. For some, those challenges, they may not be diagnosed until the age of 7 or 8, or even sometimes into adulthood, because many times the challenges that they have allow them to adapt, to function, to mask. Many folks on the autism spectrum call it masking, where they are able to sort of compensate for their challenges and pass or get by as neurotypical. Neurotypical meaning not having any differences to their neurological functioning.
That's really interesting. So I want to now go to your own personal experience. You are the mother of an autistic child, and I guess I'd like to know how that has informed the work that you do. Did it change the work that you do? Just tell us a little bit about that.
Well, first I have to just correct one fact. He's not a child. He's 24 now.
Oh, okay, so he was a child.
And he wouldn't want to be called a child, I can tell you that. But you couldn't have known that. In any case, yes, I was already working in this field. My training is as a social worker, and I was doing clinical work with students on the autism spectrum and with other challenges long before my own son came along. And how has it changed my work? One thing I would say is that when I first chose to go into this field, it wasn't because I had any family background or history with autism. I was new to autism, and I found it absolutely fascinating. I really thought it was so interesting how differently these minds worked, and how hard it was to engage them and make a connection. And when I was able to make that connection, it just felt like bright lights were shining, and it just felt really powerful, and I just loved that. Then I went on to have my own child, and not as exciting, I have to say. Not as fascinating. Really, I would use very different adjectives. I would say difficult, challenging, overwhelming, exhausting, lots of different adjectives. So it's been an interesting journey, and I think I'm grateful that I had a background in working with folks on the autism spectrum before my son came along, because I'm sure that was helpful in guiding, how we raised him and where he's at now. So I'm grateful for that. But I'm also grateful that being a parent has given me very different perspectives on the educator experience, and the parent experience, obviously. And I now use my dual perspectives from both sides of the table at parent-teacher conferences, as parent and professional, to help bridge gaps in understanding, which are so common and so broad between educators and parents or guardians. I really try to convey what the parent experience is like to educators and what the educator experience is like to parents and guardians, and really try to help foster collaboration and partnerships, because it's so important.
Well, you must have empathy toward both and equal measure. So let's go back to the educational experience and even your sons, if you want to discuss that. You've been a proponent of the inclusive classroom. So your books are about that. Can you tell us what it means to have an inclusive classroom, and why do you think that is important for many children with ASD?
Well,
Was your son in an inclusive classroom at the time?
yes and no. I'll start by telling you what an inclusive classroom is not, which is it's not a classroom where lots of different kids are just kind of thrown together, like to see who sings and who swims. It's not that, or with teachers who don't have any training in working with autism. And what an inclusive classroom is, ideally, is a classroom that's a full-sized classroom that's composed of lots of neurotypical students and neurodiverse students. That would be those who have different neurological functioning in some ways, but also that is run by ideally two teachers full-time, one a credentialed general education teacher and one a credentialed special education teacher, who can team up and provide all of the students with a really rich, robust experience in which everybody benefits. And the ways that everybody benefits is that the neurodiverse students, let's talk specifically about students on the spectrum, really benefit from having the exposure to all different kinds of social functioning and the social modeling of their peers. But that doesn't happen spontaneously. These kids don't typically learn by osmosis. It needs to be facilitated. And then those kids can really benefit from the social modeling, the academic challenges, the academic rigor, and just being a part of the mainstream experience in the school. Their academic functioning ends up being better. Their social functioning is improved. Their self-esteem is through the roof, which I think is maybe arguably the most important thing. And even their long-term outcomes tend to be better in terms of their ability to live and work in the mainstream society, which is the world we all live in. And even students who are not on the spectrum benefit from this experience, because I really feel strongly that these days, particularly, all our kids are growing up in a society that's more diverse in many, many ways than it used to be. And I don't just mean including folks on the spectrum. I mean also, racially, culturally, in terms of gender diversity, sexual orientation, all different ways. And I think it's crucial that our kids, that like acceptance of diversity and differences gets baked in from a young age, because today's kids are growing up in a society where they're going to end up working alongside and living with and loving all different kinds of people. So that's what I really love about inclusion.
Well, I'm thinking of parents of neurotypical children, and sometimes they are loath to perhaps have children on the spectrum in the same class. Is
Yes.
there any downside for a neurotypical child to be in a classroom of neurodiversity? And also, are all children on the spectrum able to function in this kind of an inclusive classroom environment?
You led me right to the answer on that one. Two things I would say. One is no, in my opinion, and I think in most opinions, inclusion's not for every student on the spectrum. In some cases, that large class, a large class size, no matter what the teacher-student ratio or student-teacher ratio is, you can argue that a 25 to 2 ratio is essentially the same as a 12 to 1 ratio, but it's really not. So that's 27 bodies in a room. And for some kids on the spectrum and others, that's just too many people moving in too many directions. It's louder, it's busier. The transitions in an inclusion classroom can be, there may be many more. There may sometimes be just not enough opportunity for individualization or special education. There's special education strategies that may not always be able to be applied in that larger classroom. So in some cases, I do think some students on the spectrum will benefit from a smaller classroom, especially if there are behaviors that become a barrier to learning for themselves or for others. And that's something that educational administrators really have to look out for. If a student on the spectrum becomes such a disruption in the classroom that it's interfering with the learning of others, then that's not an appropriate fit, and that needs to be looked at more closely. So students on the spectrum are usually chosen specifically for inclusion classrooms. It's not just done at random. The law from IDEA dictates that all students with disabilities have to be educated in what's called the least restrictive environment, LRE, which means the environment that affords them the greatest opportunities for mainstreaming as possible. So when it is possible, inclusion should be tried, but it's not going to be a fit for everybody.
It sounds like with the care that you're advocating being given about who gets into this inclusive classroom, there would be little downside for a neurotypical student. Is that correct?
Right, because that's what I'm saying is that if a student on spectrum becomes a barrier to learning, then that is not going to be a good fit. But there are also benefits for students, for neurotypical students, in addition to those about learning about acceptance and diversity that I mentioned before. Other benefits are that having two teachers in the classroom, one especially with different kinds of strategies and creative interventions, can benefit everyone. So even students who can benefit from some enrichment, who can go a little farther or a little deeper into certain activities, can really benefit from having two teachers in the classroom. Those two teachers are there for all students. And it's important that I think a lot of times parents get a little concerned, because what I have found is that teachers struggle to explain inclusion to parents, and administrators do too sometimes. And when they feel a little cagey about it, I think parents and guardians pick up on that, and they feel like the school's hiding something. So I work sometimes with educators to help give them the language to explain inclusion to all parents in a way that's clear. There's nothing to hide here. We're not hiding anything. That it's not, if a neurotypical student is placed in an inclusion class, it's not because the school suspects that they may have challenges or anything like that. It's that it's beneficial to everybody. And it could even be because your neurotypical child could benefit from some enrichment, some extra creativity and options. So it allows for different kinds of groupings in the classroom, all kinds of different creative educational solutions. So I think for neurotypical kids, it's great, actually.
Those are some great points that I think most of us have never even considered. So thank you for bringing them up. Let's talk about some of the learning challenges that a child on the ASD spectrum might confront. What are some of the issues?
So many. Sensory is almost always a challenge. Some students are highly reactive to sensation. Some are minimally reactive to sensation. Most can be both. It can be very variable and very unpredictable. Language is often so sensory is almost always a challenge. Language is almost always a challenge too. Sometimes in terms of actually being able to communicate with words, up to about 30% of students on the spectrum are minimally verbal or nonverbal. But language is also a challenge for those who are highly articulate in the social language sphere, pragmatic language. So that's usually a factor. Cognition is often a challenge. Students on the spectrum tend to be very concrete and have difficulty generalizing information accurately and filing it into meaningful categories where they can retrieve it readily. Engagement is almost always a challenge. Students on the spectrum have, as I mentioned in terms of the diagnosis, tend to have very repetitive and rigid areas of focus and interest, and it can be very challenging for teachers to pull them, to lure them out of those circumscribed areas of interest, and bring them toward the curriculum. The flip side of that is that because of these deep, intense, and narrow interests, sometimes students on the spectrum become extraordinary experts in very narrow areas of focus, which is kind of an interesting flip side and a good thing. Often unconcerned about socialization or how they will appear to others, they can go far deeper into singular areas of interest than the rest of us may have the space to do. Other challenges, executive function, which is kind of the brain's ability to micromanage actions and reactions. So that can affect so many areas: impulse control, shifting gears, planning ahead, reflecting on past experiences. That's a big one. And with all of those challenges, it should come as no surprise that most students on the spectrum struggle with anxiety. I shouldn't say struggle, but cope with anxiety. Anxiety is almost ever present for these students, and it's little wonder why, given all the challenges that they have. They're always on guard against sensory assaults or other things that will pull them out of their comfort zones that they're so carefully protected.
So it would be difficult for that's something then the classroom teachers really have to work on, I suppose, all the time, is regulating that anxiety. A lot of children have anxiety, of course, when they go to school, but you're saying that especially for these children, it's really always present and it has to be dealt with. Can I ask you, we're actually running out of time. Are you advocating that if parents or caregivers of an autistic child are watching, that they give good consideration to putting their child into an inclusive class? Would you say they should look into that first rather than not?
Well, that's a hard one to answer. It's not necessarily only up to parents and guardians.
Okay.
The placement is going to be determined by the school, but parents and guardians, ideally will need to be on board. And if they're not comfortable with that recommendation, then that needs to be considered. But ideally, the school and the parents and guardians can work together to come up with an idea that works for their student. In some, you asked me earlier about my son, and I never answered that, but I can bring that in here, which is that my son did some sort of like partial inclusion. In elementary school, he spent part of the day in an inclusion classroom and part of the day in a special, then that was then called a self-contained classroom. So there are variations that can work for different families. It's certainly something that can be tried, tested, and parents can hopefully be assured of why the school is making a recommendation for their child, and what's in it for their child, what the school hopes they'll get from it.
Can I ask what your son is doing now?
Sure. My son is actually doing far more than we ever imagined he'd be able to do. He finished high school with an academic diploma by the skin of his teeth. Thank goodness there were safety nets in place from the state that allowed him to get his academic diploma in New York State, and all kinds of supports. And he went on to a post-secondary independent living and vocational training program in Massachusetts. We live in New York, and this program is on the campus of a university. So it feels like college. It really isn't college. It's a certificate program, but it feels like college. And their classes were in the college classrooms. They had their own dorms, and his classes were nutrition and budgeting and medical advocacy, self-advocacy, social media safety, hygiene, also travel training, work skills, independent living skills, all of that's cooking. And that was a 2-year program. And since then, he's been living independently with some support from this program. And he has a full-time job. He's a COVID screener at a hospital, actually. He commutes independently. He's managing his job independently. And we're just, and the most important thing, Linda, in my perspective, is he has friends.
That's wonderful.
And he never had friends before. So it's tremendous. We're so pleased and so proud of him.
I want to thank you so much because you have been so informative And your own story is so inspirational, not to use a cliche, but to say that it really is. It really says
Thank
what
you.
can be done. And I want to thank you for sharing that. And so thank you so much, Barbara Boroson, for joining us today on
Thank you.
Raising and Teaching Children who are on the autism spectrum. So thank you again so much.
Thank you.
Don't go away. We'll be right back with our Ed Bites. Welcome back to this edition of Ed Bites. The U.S. is currently facing a real teacher shortage. In educational leadership, education expert Linda Darling-Hammond maintains that the current shortage of teachers is not sudden, but the result of decades of cutting programs, lack of respect for the profession, and poor working conditions. And the pandemic didn't help. It really can be too hot to learn. Research indicates that warmer temperatures are linked to worse test scores, especially among lower income and minority students. Bottom line, a report from Pennsylvania State University Center for Evaluation and Education Policy Analysis found that the ideal temperature range for learning reading and math is a classroom temperature of between 68 and 74 degrees. According to Smart Brief and Leadership, a study by researchers from Indiana University indicates that students with disabilities achieved higher test scores on state assessments when they spent at least 80% of their learning time in general education classrooms. These students also did better in college and in finding jobs. That's it for this edition of EdCast. Thanks for watching. See you next time.
We'd like to hear from you. Please send your thoughts and comments to cunyedcast@gmail.com.